Hey everyone, my name is Frontier.setter. First off, I want to thank all my great subscribers for giving me suggestions ever since I posted my last EDC video. So, I've been pretty complacent with minimal carry ever since I moved to Fargo, and I really haven't been down on carrying medical supplies just because I feel a lot safer here, but that's always not a good thing. So in this video, we're going to be covering my new, super discreet meme tier trauma pack that I carry every day. So, let's get to it. Now, before we begin, I have to preface this video with a little disclaimer. Even though I'm technically a professional, I'm pretty much just a dirty weeb who sits in his room, watches anime all the time,
I have the power of God and anime on my side!
and pretends to shoot guns. So this little thing is just purely for entertainment only. That's like the third time I've done this. Regardless, carrying some degree of medical equipment with you is a good thing, especially if you are carrying a firearm. So here's my setup and kind of the reasoning behind what I picked. So there are a few approaches to trauma. TCCC, or Tactical Combat Casualty Care, focuses on the MARCH algorithm, which stands for massive hemorrhage, airway, respirations, circulation, and hypothermia. I'm not actually trained this way. My gear is more focused on the TNCC, which stands for Trauma Nurse Course. And it's kind of the same thing, but a little different. I think it's a little easier. And that algorithm is CABC, and we'll go through all the steps in this portion of the video. Here, I'm mainly focused on the primary assessment, in this case, after a gunshot wound or a penetrating knife wound. So, obviously, before you can take care of anybody else, you have to take care of yourself. Call 911, stay calm but aggressive. You best not be lacking in those situations. If all goes well, all threats will be neutralized, or you and your patient will be in a safer place. So I really want to get one of those anime-styled Ahigo items, you know, but I want it in like a fanny pack format. But J-List, Otaku Mode, and all these other shops didn't carry that kind of gear. So maybe when I get to Japan, I'll be able to pick up something hype, but until then, this Adidas pack will do just fine. So as I said, memes aside, carrying your gear in a fanny pack actually has some huge advantages. It's super accessible. It's always on your hip, doesn't take up belt or pocket space. And it's very well hidden. Even though it's like big and bulgy, it doesn't really give away any of its intentions. You know, unlike those Molly packs that you see, it's just too obvious. Sometimes people are just too tactical. And the nice thing about being a civilian is your biggest advantage is being underestimated. It's also very EDC friendly. I don't have to change the layout of it that much, so I just pretty much just slap it on my waist and I'm good to go. Most importantly, it doesn't get in the way when you draw your firearm. So, following the CABC algorithm, first we have circulation, because severe hemorrhage or blood loss is the biggest threat to life in these traumas. So, we gotta look at that first. So to treat this, we actually have to assess for blood loss. And the easiest way to do that is to see where there's blood and there's holes. I could make this easier on myself if I carried a pair of trauma shears, but I'll get to that later. I carry a cat tourniquet. It's a Generation 7, and it's got this really nice windlass, and the Velcro is super strong. And this tourniquet will obviously be used on just your limbs. So I'm not sure if this is a myth or not, but I've been told that all these tabs are red, not just because it's easier to see, it's because it's one of the last colors that you do see when you are about to pass out. So that's why it makes it easier for you to operate. We also have here some Celox gauze. Now this is the ribbon type, and it's kind of small and thin, so it's really easy to jam into those gunshot wounds and stuff like that. But I might replace this with the thicker kind just because that adds a little bit more wound pressure. Now it's really cool because it's actually ingrained with this hemostatic agent, which really helps with clot formation. And this is only for muscular areas, as I said before, like the limbs. Because if you try to stuff the chest or the abdomen, there's too much space and air and it's too squishy, so the gauze won't really do much help there. But we'll address that in the later portion of this video. I could add some more plain gauze to this kit as well, just to provide more absorption and just, you know, pressure, but right now this is all I have. So next we need some kind of dressing. I have here the emergency trauma dressing, and this does have like a gauze pad inside, and it's super stretchy and elastic, so you can just really wrap it around parts of the body, whether it be your limbs or your chest, as long as it doesn't block your airway or your respiratory drive. And I should mention that I should carry more PPE or personal protective equipment, but I don't, like gloves, so like YOLO to that. Next on our alphabet list is airway. Pretty simple. We need to assess for a secure patent airway. Now this can be a huge issue if the patient has sustained like facial trauma or head trauma, anything like that. There's a lot to know about when it comes to traumas. And you don't always want to use the head tilt chin lift technique, especially if your patient has suffered a C-spine injury. And you won't really know this in this confrontation, you know, if they fall backwards or something like that. So one of the best techniques that you can use is actually just the jaw thrust. You just thrust the jaw forwards, and this actually helps move the tongue away from blocking the throat. So let's say the patient is unconscious or has difficulty breathing and can't manage your airway. So this is why we have this NPA. It stands for Nasopharyngeal Airway. And this is a 28 French. It's pretty much like the average size of a person. And there's a way to measure it and stuff. But yeah, this is the easiest, fastest way to secure airway. Next on our list is breathing. So we have to assess the patient for a couple things. The rate, the depth, if it's the spontaneity, and if it's an equal chest rise or not. So especially with penetrating wounds to the chest, you really have to worry about this opening space to the pleural cavity. Any kind of puncture can really severely compromise the respiratory drive, and you don't want that. And that's why we have these Hyfin chest seals. These are vented chest seals. Anytime you see a hole, just slap one of those chest seals on. But the thing about any of these high energy wounds, like a gunshot wound, is that you have to look for an exit wound. So that's why these packs always come in a twin pack. So you can put one on the front and the back if you do see one. These chest seals are also really good for abdominal wounds. As I said before, you can't really stuff anything in there because it's just so squishy. There's no muscle there. So you can plug it on all the gauze you want. It'll just get leaked into that cavity. It won't do much in terms of stopping bleeding. These seals are good for that too. Just slap it on there and it keeps everything in and clean. And you can actually fold these into however you want. They're pretty much just really tacky stickers that stick on the skin like really good. So you don't have to worry about like folding them in a bad way. As long as it's in the packaging, the moisture will be retained, so the stickiness adhesive will still be viable. So you can carry decompression needles. I don't, because I'm not really trained or versed in that skill, and that's to address pneumothoraxes or a collapsed lung. It's a pretty cool technique, but I'm not confident in it, and I don't think I would be in this kind of an intense situation, so I don't carry decompression needles. So again, we have to come back to circulation. We have now come full circle in our CABC algorithm. We're gonna check the pulses again, look for cap refill, coloration, other signs of bleeding, and if we need to readdress any of our bandaging. And hopefully by this time, 911 has already been called and the police and EMS are on their way, and just kind of stabilize your patient and have your gun just in case anything else does go to shit. I really hope you enjoyed this video. This is just a quick look at some of the gear that you can actually buy yourself, and it's good because you can actually help save somebody's life. I have to say again that this is in no way a substitute for an actual educational or training course. But I do hope that this video did spark some interest, and if you are interested, look up some training classes. You might learn a lot, and a lot of these skills are invaluable because, like I said, they will help save your life or somebody else's. Now, I know I'm lacking a lot of stuff in this kit, like shears, gauze, and gloves and stuff like that, and it's always going to be a work in progress. So let me know down in the comments what kind of gear you carry daily, if it's different than what I have here, and any suggestions and changes to gear you might have to my own setup. I'm always down to learn a whole bunch of stuff, and I try to answer questions that you might have. So yeah, with that said, please like the vid, share with your tactical friends, and subscribe to my channel if you want to see more of this kind of content. And always remember, stay tactically kawaii.